Hi everyone, my name is Moritz Herle. I'm a lecturer in psychology at the Institute of Psychiatry at King's College London. One of my main research focuses is to understand why people with eating disorders have a higher risk of self-harm and suicide. So I think eating disorders are one of the most misunderstood disorders within psychiatry. So in comparison to other disorders like depression or schizophrenia, I think there's a lot of kind of deep misconceptions about eating disorders. One main misconception is that people kind of think, oh, eating disorders are not that serious, they're kind of their own person's fault, they're kind of self-inflicted, people kind of just want attention or need to get over it, need to get out of it themselves. But actually what we know from clinical research and more kind of data science, epidemiology research is that eating disorders are some of the most severe psychiatric illnesses. So we know that people with eating disorders, especially anorexia, have a high risk to die full stop, but also within there to die of suicide. And I guess because we know that kind of clinical link exists, but we don't really know why that's happening. This is also why I think it's amazing that MQ is funding this kind of research. So my research program is really trying to get to grips, to understand why this is happening, because once we know why, we can also think about what are potential intervention angles. So I think people often really misunderstand the severity that eating disorders can have on the individual, but also then, of course, on their families, loved ones, and as a wider sense on whole society and also the economic impact that long-term illnesses have. My main research at the moment is on this understanding this mechanism between eating disorders, self-harm, and suicide, and we try to address this question using kind of two complementary methods. So on the one hand, we are having a big qualitative study where we are interviewing people with lived experience of an eating disorder, self-harm and suicide, but also clinicians who work with this group of patients. So we're looking at that from a very kind of qualitative, interview-based perspective. And then on the other side, we're kind of trying to address the same question, but using big data sets of tens of thousands of people, where we have measures of these different concepts and behaviors, and we're trying to address this question from the two sides of things. And the qualitative parts of the big interview study is slowly coming to an end. So we're just finalizing the results, we're analyzing our interview scripts, and we're about to write up the final piece about this. And I think it's been really interesting to see the kind of synergies between what the people with lived experience are saying and what the clinicians are saying. What's one of, I guess, very positive outcome is that actually both groups are actually saying very similar things. So actually, the people with lived experience and the people who work in treatment actually have a very similar opinion, which I think already is quite a nice message, that there's actually a lot of overlap and a joint kind of idea about what's going on. And we've identified a few kind of pockets where we can see where there's potential for interventions. And one of that is one thing that we in my team are quite interested in is the idea of recovery. So recovery in eating disorders is like a big topic in its own right. We really have found that from those interviews that the moment when recovery starts, or there's kind of transition from treatment into the more recovery process, is where often people found they're very vulnerable for self-harm and suicidal ideation. Often a lot of support that's in the inpatient services kind of gets stripped away. People feel a bit more, they have to more stand on their own feet. They maybe don't have that stepped approach of leaving slowly the treatment pathways, become more independent. And also they kind of are then well enough to kind of reflect on how much time they've spent being very unwell, how much time they spend in treatment, some of the relationships that maybe suffered through that period. And sometimes these kind of emotions that come out of that process can be very overwhelming, and trying to find strategies to regulate those really big emotions is where there is a big potential there to support people to make them more secure so they don't really get pushed into that kind of self-harm, suicide ideation space that is often happening there. So this is an area that we're quite interested in kind of exploring further. So we will use this kind of recovery as a risk factor for suicide as a little bit of a framework to think about how we're going to think about interventions and kind of use the future research. So it's going to be interesting moving forward, and hopefully will result in some very good and tangible benefits for the people that are really need the support. And I think one of the frustrating things, I think many researchers, is that we often know a lot what the problems are. So we often know that poverty or growing up in poverty is one of the biggest risk factors for essentially all health outcomes, mental or physical. So it's in a way like we already often have the answer to what the big problem is, and if you would give me all the money in the world, maybe it wouldn't be enough money to eradicate poverty, but I think that we really need to, as a collective of researchers or people in society, we need to push for policies and advocacy that eradicates poverty, especially poverty in childhood, because lifting people out of poverty will have such a huge impact on health outcomes. And that will be obesity-related things, but also eating disorders. It will, will have such a huge impact. So it's not really a research question because the answers are already there. There's quite strong evidence that poverty is a huge risk factor. So give me all the money and we make something happen so we can eradicate that, because I think that will be the thing that will have the biggest impact across a huge set of domains.